One thing that consolidation has resulted in is just the speed at which innovation has been occurring, and it's accelerated that. So I think what's important today may not be important tomorrow.
With me now is Joe Johnson, who is the Managing Director and Co-Head of the Healthcare Services Sector of L.E.K Consulting, as well as Todd Clark, who is the Managing Director and Head of Healthcare IT, also at L.E.K Consulting. You two, welcome. I'm excited to have you here. I know you guys are widely versed and knowledgeable about the trends of 2022, and I kind of like to go through them with you in terms of what's happening. So the first thing I want to bring up is consolidation, and I want to know, and why don't we start with you, Joe, of what is driving consolidation in healthcare IT?
Hard to pin it to one thing. There are multiple things, but I think three big things that are happening is one, a desire to really better integrate the clinical workflow. I think a great example there would be the deal that just got consummated between Stryker and Vocera, where I think because of that acquisition, Stryker is going to be able to better leverage some of the digital tools and medical devices that they have and connect them to the clinical communications workflow. I think another great example of what's driving consolidation would be a drive to automate. I think we all appreciate that healthcare can be very manual, very labor intensive. And so healthcare IT companies want to better automate and gain efficiencies. I think we've seen automation play out through revenue cycle management, through release of information, and even risk adjustment and coding. And then I think another trend or theme that we're seeing a lot of is this desire to broaden the scope of offerings that exist and really try to sell to more an enterprise level. I think we're seeing a lot of that in the governance, risk, and compliance space. So some of the acquisitions like RLDatix and Verge Health or Simpler and Midas are great examples of those companies trying to bundle more into their offering to be able to then sell to higher C-suite levels.
It's actually really cool to hear about how companies are actually beginning to collaborate. So Todd, for you, what segments would you say in healthcare IT are you seeing consolidation, and how has it evolved in the past 3 or 4 years?
The first one that comes to mind is behavioral health. It's a segment where every provider group, every modality has a shortage of providers.
Yeah.
And so making sure that workflow is as efficient as possible and reducing the administrative requirements of those clinicians is critical. Some examples there: WellSky, Therapy Brands, New Directions, behavioral health, lots of deals going on there, and I think that trend will continue for a while. The second one is, and this is part of a theme, which is point solutions are actually able to become more important rather than, I think there's a conventional wisdom that they're less important over time as interoperability improves. And so a great example of that is patient payments. And you've got a number of deals with end-to-end RCM providers who for a long time have considered patient payments secondary. But you've got the R1 acquisition of VisitPay, and you've got Patient Co with Waystar, and even Meduit, who's a specialty player, acquired a patient payments company. So given the focus on the front end in RCM and the importance of patient satisfaction, the increasing importance of patient satisfaction to providers, that's an important one. And just RCM end-to-end players in general are pushing towards the front end in terms of building out their solution sets. Yeah. And you see two recent deals with nThrive, TransUnion, and Pelletas, as well as the CloudMed acquisition, more focused on AI, for R1.
It is pretty interesting to see with the trend of healthcare becoming more patient-centric and patients having a lot more right to kind of pick what they want when they want it. It's interesting to see how that is making other companies respond. Joe, in light of interoperability, are you actually seeing opportunities that are being created for that and also for data sharing?
I think we're now living in a world where there's more of an opportunity for point of care, real-time information sharing. So I'm thinking of maybe even real-time prescription benefit solutions that are helping avoid some of the hurdles around patient access or reimbursement and prior authorization. So tools like Doctor First that are being presented at the point of care to recommend to a doctor, what is best for this patient given their insurance and their
personalized.
coverage. Right. Another thing that we're seeing is because of interoperability, the ability to share data more freely. There are more multi-sided networks that are popping up. And by that, I mean information being shared across different stakeholders within the healthcare
Payers,
ecosystem.
providers.
Providers, life sciences companies. And I think one big theme that we're starting to see is life sciences as a big funding source for healthcare IT operators and vendors.
Wow.
They hold a lot of the purse strings, and I think given some of the provider fatigue or payer fatigue in funding, life sciences is a great alternative.
Isn't it interesting to actually think that so much of the administrative stuff in healthcare was kind of considered originally like back office, over there. And now, we had a recent interview where someone was talking about how clinicians are getting involved with the supply chain, really trying to all come together to make this work. Todd, other opportunities that you see coming down the pike for consolidation?
Anything related to patient engagement is fair game and is still fertile ground for a lot of different players, whether they're EHR players, RCM players, clinical decision support. There's just lots of opportunities to close that loop, especially as providers are trying to figure out how to coexist with one foot in the fee-for-service boat and one foot in the value-based care boat, where they've got current profit centers that are shifting to become cost centers. How do you manage that, and how do you manage that process?
How complicated is that answer? It's hard.
You're literally taking, let's say, your 5 most profitable profit centers, imaging, labs, et cetera, and those become costs to the value-based care world.
Right. A whole different world. So what does this all imply for healthcare IT operators, and where do you imagine them as this all begins to shift? Where is a good place for them to find investors?
One thing that consolidation has resulted in is just the speed at which innovation has been occurring, and it's accelerated that. So I think what's important today may not be important tomorrow. But having said that, I think it's important to realize, and Todd alluded to this earlier, that the point solution still has a right to play and will exist, throughout the ecosystem. And in fact, I think because they're able to address unmet customer needs, the balance of power perhaps is shifting in some cases towards those point solutions and maybe a little bit away from the core anchor systems like the EHR or claims management systems for payers. So I think partnerships, collaborations are certainly going to be increasingly important in this environment.
Wow. Well, I have to admit, I really love hanging out with consultants because you guys have a really interesting view on healthcare. I hope you guys have an amazing conference, and thank you so much for your time.